Okay. And his testimony about Christi hurts worse after surgery, was that a fair statement?
Yes, sir.
And is that based on her complex regional pain syndrome?
Yes, and the fact that this surgery is a painful surgery.
Okay. Because you're, I mean, as you said, you're drilling into bone.
Correct.
Among other things. As a result of the SI joint fusions, has Christi had a significant loss of bodily function?
She certainly has a decreased mobility in her pelvis.
And is that condition permanent?
Yes.
Will she have permanent scarring as a result of these surgeries?
Yes.
I'm going to show you. These are part of Plaintiff's Exhibit 8. These are photographs recently Christi sent to me. Can you hold those up for the camera? Can you show us what, I mean, she labeled that, and I don't want to taint your testimony, but that's where she labeled where the surgery scars were. Does that correlate to your understanding?
It does. So this would have been the incision for the right SI joint fusion here and here.
Okay. And what is it, September 2nd today, 2020?
Yes.
And this was done, the right one was done in March 13th of 2019. Is that correct?
Yes.
And what did she say, the camera area, what is that? Or did she mislabel that?
Oh, yeah, this is the second incision that I make to visualize the sacroiliac joint directly.
Okay. And the other one, is that the other side or is that the same side?
This is the left side. So this would be where her stimulator battery is,
Okay.
right here. She would have another incision below this
Okay.
for the three triangular grafts, and then there would be a matching incision here next to the midline.
Okay. Is that reflected on this, or is that a different?
No, this shows both of the incisions. This would be the stimulator battery right
Okay.
here, and then this is the SI incision here.
Okay. And those fairly inaccurately depict the scarring Christi has
Yes.
as a result of the SI joint fusions
Yes.
you performed?
Yes.
Okay. I'm going to ask you, I got some imaging from Mobile Infirmary, and this is, I'm all wired up here if I can stand up. This is Plaintiff's Exhibit 12. Let me turn this on for you. Is it on? Yeah. Can you point to us, first of all, is this Christi's, what type of imaging are we looking at here?
This is just a AP x-ray of Christi's spine, her hips, and her legs.
Do you know what the date of that is? It's in the top right corner.
August 19th, 2019.
Okay. Would this have been after both of your bilateral surgeries?
Yes.
On Christi? Can you tell us what if the hardware is up there and where it's located?
Sure. So this is her spine coming down right here, and then this would be her hip right here, and this would be the stimulator battery that you can see here.
Mm-hmm.
The stimulator leads are up here in her spine, and the sacroiliac joints are right here and right here, and you can see the spacers or the grafts that are across each SI joint.
Okay. Does that fairly inaccurately depict, I guess, the anatomical, the hardware that you inserted in the bilateral SI joint fusions on Christi?
Yes, sir.
Okay. And that was dated August 19th of 2019. I don't move to admit Plaintiff's Exhibit 12.
Is that good?
And Doctor, have all the opinions you've given us today in this deposition been within a reasonable degree of medical probability
Yes, sir.
and reasonable degree of medical certainty?
Yes, sir.
Would you agree that the surgeries, the bilateral SI joint surgeries you performed on Christi was performed to alleviate her pain?
Yes, sir.
Did you ever place, or have you ever placed any physical limitations of Christi during the course of your treatment?
Yes.
Can you tell me about that?
Following surgery, I would have placed her on a rolling walker. with touchdown weight-bearing restrictions on the side of the surgery. Also, she would have had restrictions for bending, lifting, twisting, also restrictions on driving.
Would she have difficulty sitting for long periods of time?
Yes.
Were you aware of the nature of her employment before she was involved in this, correct?
I was not.
What kind of difficulties in your training and experience would someone who had a sedentary employment position have?
People that experience pain in their SI joints and have surgery for it have difficulty sitting for long periods of time and standing for long periods of time. It also becomes difficult to lay down flat for long periods of time. So basically they have to be able to get up and down frequently.
Would sitting for longer than an hour be a difficult process for Christi?
Probably.
And to alleviate the pain, she would have to stand up,
Correct.
but she couldn't stand up long because that would cause problems as well.
Correct.
And then when she tried to lay down, if she lay down for long periods of time, that could be problems as well.
Yes.
What type of relief would a patient like this have?
It's difficult to say. That's why she's been through all the surgeries that she has.
Right. And she still was experiencing pain when she saw you last, is that right?
Yes, sir.
And the last time she saw you, according to my records, was September the 17th of 2019, is that correct?
That's correct.
And is that when you referred her out to the orthopedic doctor?
Yes, sir.
Okay. Did you give any permanent impairment rating for Christi related to the fusions?
I do not.
Have you given similar patients impairment ratings?
I do not.
Okay. Do you anticipate Christi having problems with perhaps adjacent joints?
I think she is at risk of, like Dr. Yearwood explained in his testimony, developing instability in the lumbar spine, specifically at L5S1.
Okay. Do you believe that based on the instability that there's a real likelihood that she may have to have surgery to repair the anatomy you just said?
I think there's a chance that she could go on to require surgery for that.
Would you say that risk is more likely than not?
Yes.
And that's your opinion to a reasonable degree of medical probability?
Yes.
And a reasonable degree of medical certainty?
Yes.
Will she be a candidate for any future SI joint procedures, injections, ablations, or anything like that if she continues to have pain?
If she continues to have pain, yes, she could undergo further SI injections. I would not recommend any further radiofrequency ablations.
How do you think the normal aging process for Christi will play out based on the procedures and surgeries you performed?
I think that she's probably going to have more pain than your average 43-year-old, and that's just from the accelerated arthritic process.
Okay. And do you concur with Dr. Yearwood's deposition testimony that about what you've already testified to?
Yes.
Is this a permanent change in Christi's anatomy, these SI joint fusions?
Yes.
Is she, you believe, don't tell me if I'm misleading you, that she's more susceptible to future deterioration and injury now because of these injuries?
Yes.
You think Christi will have more difficulty in the future performing activities of daily living?
Objective form.
Yes.
Can Christi exercise or run?
She can, but she would likely have significant pain.
Has she expressed her desire to do these things?
Yes, she was a very healthy and liked outdoors, liked to do things outdoors.
Do you think that because of these surgeries it's curtailed that or made it more difficult?
Yes.
And will continue to do so in the future?
Yes.
Did Christi follow your instructions, come to her appointments, and did you find her, that's a multiple, let me rephrase that. Did Christi do what you asked her to do?
Yes.
Did she miss any appointments?
Not that I'm aware of.
Did she follow the instructions that you gave her to try to get better?
Yes, sir.
And did you believe Christi when it came to describing her pain?
Yes, sir.
And she was cooperative with you regarding her treatment?
Yes, sir.
Do you think Christy wanted to get better?
Yes, sir.